Hello, my loves. My name is Brandy. I'm a licensed mental health therapist, and today we're going to talk about seasonal affective disorder. If you're starting to notice your mood dropping, motivation levels are a little bit lower than usual, or just less energy overall, especially as the days get shorter and it's getting a lot darker outside, you are not alone. These feelings might actually be a form of depression, and more specifically, seasonal affective disorder, or SAD. So what is seasonal affective disorder? Seasonal affective disorder is a depression disorder that falls around the seasons. So typically around fall and winter, and usually in the spring and summer, the seasonal affective disorder can actually lift and be gone. Seasonal affective disorder affects around 5% of the population and can be particularly very intense for people who live in colder, darker places with limited sunlight in the winter. Some common symptoms of SAD include a sad or depressed mood, changes in your sleep, having an increased appetite for foods, difficulty concentrating, less energy, less motivation, things like that. And SAD can sometimes lead to social isolation or feelings of hopelessness as well. And if your symptoms feel overwhelming, it is very important to seek help to help kind of cope through this time and what you're experiencing. Let's talk about seasonal affective disorder versus just having the winter blues. While many people might feel a bit down during the winter seasons because of the colder weather or it getting dark earlier in the day, SAD is a lot more intense than just having the winter blues, and it often does require some form of treatment. The key difference here between feeling just those winter blues versus having seasonal affective disorder is it is impairing your daily functioning, such as going to work, doing your daily tasks and responsibilities, getting along with other people, things like that. While winter blues are a lot more milder. So why does SAD happen? So there's some biological mechanisms for SAD. First being a circadian rhythm disruption. So less sunlight during the day affects our circadian rhythm and how we're going to sleep. Our circadian rhythm is our internal clock. During the winter months, winter seasons are disrupting our internal clock because it's getting darker early in the day, and this can affect our sleep patterns and changes to the way that we sleep, insomnia, difficulty falling asleep, maybe fragmented sleep, things like that. Another biological mechanism to SAD is reduced serotonin and melatonin. So reduced sunlight during the day can lower our serotonin levels, which is a hormone in our brain that is often called our happy chemicals or our happy hormones. It's a mood stabilizing hormone, and it can also increase melatonin. And melatonin is a sleep regulating hormone, causing sleepiness and lower energy. So having the imbalance of serotonin and melatonin can also be biological mechanisms to seasonal affective disorder. And it's all because of the sunlight. There are also several environmental and psychological triggers to SAD. People tend to spend more times indoor during the winter just because of maybe you live in a colder place and it also gets dark earlier, which reduces our natural exposure to sunlight and contributing to feelings of isolation sometimes if we're spending more times indoors. There's also a psychological impact of seasonal changes. For some, the end of summer and entering into fall and winter can bring up some feelings of loss, which can contribute to SAD. We're sad that the warm summer days, the carefree feelings of summer and all the activities that you can no longer do some of those in the fall and winter, which can cause some feelings of SAD. There's also less social interaction sometimes, which can expand that feeling of loneliness. So what are some ways to effectively manage feelings of SAD? For one, light therapy. So there's a lot of different ways you could use light therapy, but light therapy is sometimes a special lamp that you can get, and you could use it inside for like 10, 30 minutes a day to kind of get that exposure to light that you might not be getting. Also, I really encourage you, and this is something I personally do, is first thing in the morning or really at any point in your day, even if it is cold, wear a jacket, bundle up, but go outside and get natural sunlight for at least 15 minutes. Even if it's cold, this exposure to light does help our serotonin and melatonin levels. It's very important to use light first thing in the morning. It positively impacts our day day and lets us have more energy throughout our day. While it is safe to use light therapy, always make sure you are contacting a healthcare provider as well to make sure that this is an okay fit for you and that it is safe to use. Another thing to effectively manage SAD is maintain a regular routine. So make sure you're waking up and going to sleep around the same time every night, and that you kind of have a schedule for yourself, and that also includes getting exposure to light during your day. So making sure that we're waking up, going to sleep, getting exposure to light every day is also going to help manage these feelings of SAD. Another way to manage SAD would be physical activity and natural exposure to light. So the benefits of exercise for SAD, it's going to naturally boost our mood because we're going to have those happy endorphin chemicals going off in our brains whenever we work out and afterwards. It's going to improve our sleep and also increase our energy, which all are negatively impacted by SAD. So try combining outdoor time with movement for optimal ways to conquer SAD, like a brisk walk, or maybe going skiing or snowboarding if you live somewhere cold, or a winter hike, or even just having your morning coffee outside, bundle up in a blanket. The fresh air and exposure to natural light are great ways to combat the feelings of SAD. Another way to combat SAD is to practice mindfulness and meditation. Mindfulness can be very helpful for feelings of SAD because it brings you into the present moment instead of focusing on the negative thoughts and feelings that we're having. So literally like simple breathing exercises, or you can look up different meditations on YouTube, especially if it's for meditations for winter, meditations for feelings of depression, meditations for seasonal affective disorder. You can find all these things on YouTube, and I encourage you to try them. Journaling for SAD can also help. So even journaling your thoughts. How am I feeling today? How do I want today to go? What are some things that are coming up today? How can I make today better for myself? What are some things that I'm grateful for? Journaling can also be a great way to kind of let out those feelings, check in with ourselves, and set intentions for our days. Also, make sure that you are nourishing your body with the right diet for you. While it's very normal to crave comfort foods during winter, and as you should, eat whatever you want to eat, it is also important to be mindful about eating the right foods to make sure you're meeting your nutritional needs. So make sure you're eating balanced meals with protein, healthy fats, carbs, fruits, veggies, to make sure you're getting all of the vitamins and nutrients that you need to feel good during your days. Foods that specifically help for mood are omega-3s, like salmon, flax seeds, walnuts. Dark leafy greens and whole grains are also known to support brain health, which helps our mood. The next thing is professional help and tools for the treatment of SAD. There's therapy and cognitive behavioral therapy for SAD. So if the feelings of SAD are just feeling too overwhelming, I highly recommend looking into options for therapy, whether it be online or in your local area. A therapist can provide support and effective treatment modalities to help you conquer the feelings of SADs, particularly cognitive behavioral therapy, which I'm a huge proponent of, and definitely works by confronting negative thought patterns you're having and starting at our thoughts, because our thoughts affect our feelings affect the way that we feel in our bodies, our physical symptoms, which then affect the way that we behave. So in therapy, by using cognitive behavioral therapy, we start by addressing those negative thoughts, switching the way that we're thinking, switching our perception of things, which then has a ripple effect to the way that we're behaving in our daily lives. Also, vitamin D supplements. Low levels of vitamin D have been linked to depression. So since we get most of our vitamin D from sunlight, many people may benefit from using vitamin D supplement during the winter months because there is less sunlight. So that could be also something that you could look into. And the last thing are some lifestyle tips to help you combat seasonal affective disorder or feelings that you might be having during the winter months. So some ways you can support your mental health during the winter months is making sure you're building social connections or nourishing the ones that you currently have. Make an effort to connect with the loved ones and the people close to you in your life during this time, especially if you are feeling isolated. Social connections are crucial to our mental and emotional health. We need to feel connected to others. This is a primal instinct that we need. And whenever we don't have that connection to others, we feel lonely, we feel sad, we feel disconnected. And it can be a very, very sad feeling. If you don't have a lot of people that you can talk to during this time, I encourage you to look up free online groups or free meetups in your area. There's a ton. If you just look up online support groups or meetups in whatever city that you're in, making new friends in whatever your city you're in, and doing some research about how you could make some new connections in your local area, or if it has to be online, I encourage you to do that. I know I might sound like a broken record at this point, but spend some time outdoors, please. Even in the winter, wear a jacket, wear what you need to wear, get outside, get some fresh air, get some natural vitamin D from the sunlight. This has significant benefits on our mind and body. The last lifestyle tip I have during this time, or if you're feeling affected by seasonal affective disorder, is to reduce stimulants and substances. Reducing alcohol and also caffeine intake can significantly help these feelings of SAD. Reducing alcohol and caffeine can help us improve our mood and have better mood stability. If you naturally turn to wanting a glass of wine or going out with friends so that you're able to relax, I encourage you to dig a little bit deeper and think about what you truly need in that moment. Maybe you just need to relax, and you can do that by trying maybe some herbal teas like chamomile or peppermint or lavender to promote relaxation instead of turning to alcohol or other substances or stimulants. Seasonal affective disorder is a real challenge, but it is something that you can manage. Remember, small daily actions like going outside, doing some mindfulness techniques, or reaching out to someone in your inner circle, someone you love and feel connected to, can significantly help improve how we feel during this time. If you're struggling, reach out to support, and you can always consider getting into therapy if the feelings just feel way too overwhelming that you can't handle it. But I do recommend trying all these different things that I mentioned here today. Thank you for watching this video, and if you found it helpful, please like and subscribe or share it with someone who you feel like this might be helpful for. Take care, and remember, spring will come, but let's make the most of this winter season and use these tools to help us get through it and feel good. Thanks for watching, and I will see you in another video.